the fetal heart rate monitor pulsated in the background. The labor and delivery nurse was quickly admitting the new labor patient who was screaming out in pain, telling the nurse that the abdominal pain that she was experiencing was far too much to bear. The new nurse, the student nurse, stood off to the side, intently listening to the cries of this new mother. She watched as the labor nurse moved about, doing all of her initial admission assessment, starting the IVs, assessing the patient's vitals. The student began to closely listen to the patient and watch the fetal heart rate monitor. As the student began to listen, she noticed that heart rate monitor began to drop. She noticed the fetal heart tones begin to decel and quickly made her way over to the patient and began to palpate the patient's abdomen. At the moment that she did that, the patient screamed out in pain. And the seasoned nurse continued to go about her admission assessment data as she had done so many times before. But when the student nurse palpated that new mother's abdomen, she recognized that something wasn't quite right. She pulled back the covers and found spots of blood on her abdomen, on her clothes, and on the bed linens beneath her. She quickly went over to the seasoned nurse and shared those assessment findings because this student nurse had remembered that she had seen this scenario play out before. The nurse and the student nurse quickly rushed the patient to the operating room. You see, in that moment, this patient was experiencing a placental abruption, and we're minutes away from that baby and that mother never leaving that labor and delivery room. Because of the quick assessment findings of that student nurse and the quick response of that team, a mother and a baby's life were saved that day. That student nurse was a Miami University nursing graduate. Good evening. My name is Dr. Stephanie Nicely, and I'm currently serving as the chair in the Department of Nursing. And I am so honored to talk with you tonight about the importance that technology plays in changing and educating our next generation of healthcare professionals. So by a quick show of hands, how many of you have had a friend, a family member, or a loved one been hospitalized? Raise your hand. All right, hands down. My next question is now, how many of you were hoping that the nurse or the doctor or healthcare provider that was caring for you knew what they were doing? So I think that we can all collectively agree that there is something so critical about the people that are caring for us, whether that be for ourselves, for a loved one, for a parent, or for a child, that they know exactly what they are doing. And we learned the importance of healthcare providers, especially during the scope of the pandemic. Now, all of us are fully aware that we lost over 100,000 nurses in the nursing profession who left, mostly because they felt ill-equipped in caring for the high acuity patients that they were seeing during that time. And when we think about that, recent reports have suggested that universities across the nation are going to need to graduate an additional 200,000 graduates each year to meet the current healthcare demands. So what are we going to do? Right? I hope you all are looking at us and saying, Miami, what are you going to do? Because Miami has heeded that call. Miami has accepted the challenge to embrace the health sciences and to say we're not going to stand on the sidelines, but we are going to move forward with developing the next generation of healthcare providers. In the fall of 2024, as President Crawford said, we opened the doors to the new clinical health science building, and inside that building, we have close to 1,000 future healthcare providers that are learning in that new and creative, innovative space. We have future nurses, speech pathologists, audiologists, physicians associates, and nurse practitioners, all collaborating under one roof. In the nursing department alone, we welcome 600 nursing students between both our regional and our residential campuses. And an additional 30 graduate family nurse practitioner and nurse executive leader students. So Miami is really embraced how can we address the national healthcare shortages. But not only are we thinking about that, but we are thinking about how not only do we make them excel in their profession, but how do we ensure that when they're taking care of you or a loved one, they have the talent and the skills and the ability to do exactly what they need to do. In our new building, we have a 7-bed high-fidelity simulation center. So how many of you were able to come and see our mannequins? Just a sample of some of the high-fidelity mannequins that we have in our space. In our high-fidelity simulation center, we have the opportunity to immerse our nursing students in a simulated hospital setting. The moment that they walk in the doors of that room, they are immersed in a hospital room with the sounds and sometimes the smells that they might experience in the hospital setting. Because we want our students to know when they walk in that space, what do the heart sounds look like? What do the breath sounds look like? How do I check pulses on this patient? How do I assess whether their eyes are going to react to light? And we immerse those students in situations that they would never have the opportunity to see in any other environment. So yes, are they still going to the hospitals and engaging in all those experiences? Absolutely. But we now have the ability to have our students practice things that they would never have an opportunity to do otherwise. So that they were faced with situations like the one that I shared with you at the beginning of this story, they are fully prepared to take on that challenge. And that story that I shared with you is one of about 100 of ways that our students have excelled, not only as a student, but also when they move into graduation. So on behalf of everyone in the clinical health sciences, I thank you. I thank you for your dedication to Miami. I thank you for your dedication to the health sciences and to the future generation of nurses and physician associates, nurse practitioners, and all the healthcare providers that we serve in the clinical health science building. And with your support and continued support of Miami, we're going to continue to make a significant difference in the lives of our healthcare community. Thank you. Love and honor.